Hello, Seth Deborah. How are you?
I'm good. How are you doing this evening for me, morning for you?
Yes. So, thank you very much for giving me this opportunity to interview you.
Thank you for inviting me.
Yeah, pleasure. And friends, we have Seth Deborah here. She is a certified registered nurse, anesthetist, and medical hypnotherapist. She's a fellow with the National Board of Certified Clinical Hypnotherapists and a certified hypnosis instructor. She was inducted into the Order of Braid with the National Guild of Hypnotists in 2011 and in 2013. She received one of the highest awards within the National Guild of Hypnotists, the Charles Tebbetts Award, and we'll know more about what is this award, why was she given in a while, and she was so she was also included in the 2012 top 100 Nurse Practitioners Round-Up. That's amazing, Seth. In addition, yeah, it was like this gives me so happiness when I get the chance to interview all these pioneers of this field.
Oh,
yeah,
thank you.
Friends, she was also included in the, like as I said, she's a recipient of 2005 Award of Excellence in the field of health from the International Hypnosis Federation. That's awesome, said. She has presented at UCSF Integrative Health Forum, UCSF Student Elective for Alternative Health Class, Samuel Merrit University of Health Sciences, the National Guild of Hypnotists, Hypnothoughts Live, the American Board of Hypnosis. My God, I said you're awesome. The Institute of Advanced Studies in Health, the Dermatology Nurses Association, Kaiser Hospital in Alameda, St. Rose Hospital, blah, 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 blah. Like the list goes on and on and on. Because, friend, I'm making Seth's intro available in the description of YouTube video, which I'm going to make you available. Apart from this,
that's what happens when you get old. You've been around a long time.
Yeah, I was like, okay, did you spare anything? and also finally, friends, some might remember she became nationally known on her appearance on the Discovery Channel's Mythbusters segment on hypnosis, and this is one of the reasons said I want to interview various hypnotherapists. One of my main purposes to clear the myths around hypnotherapy, because recently there was one Hollywood movie called Hypnotic. Oh my God, the hypnotherapist, seduces that women and plays around. So many myths, and such movies really needs to be discouraged than to be encouraged.
The medical person in me, when I watched that movie, was very aware that their eyes were dilated. And I know that and the medical person in me knows that they put medicine in their eyes to dilate them, because that's really not what happens. But it was all for effect. And I was wondering if lay people realized that they dilated the eyes on purpose, to make it look like they were hypnotized and out of control, which is not what it is at all, right?
Yes.
Not what it is at all.
So on that note, let's get into the because general applications of hypnosis, at least most of us are aware. But since you come into the combination of earlier, when there was no concept of anesthesia, people used to use hypnosis, and now I'm talking to a person who is also an anesthetist and also a hypnotherapist. So how did this weird combination happen, Seth?
Well, it actually, for me, when I was in anesthesia training, and this was in Brooklyn, in New York, and my instructor, she was from she was from Russia, but
Mhm.
she had been a surgeon in China for 25 years.
Oh,
Dr. Margaret Blumenfeld, and she was like, oh my gosh, I think she was as old as I am now. But anyway, we were doing a procedure where the person had lifted up the top of a garbage can,
mhm.
and the mafia had gotten mad at him. They had put a bomb or something like that in the garbage can. And when he lifted up, remember, this is Brooklyn. And when he lifted up the top, it exploded on his face. So anyway, we were doing a skin graft from his leg to his face. But because his face had the burns on it, we couldn't put the anesthesia mask on the face. So it was basically just holding it like a couple of inches away with nitrous oxide. And in those days, we used halothane too. But because the air dilutes it, because you don't have a tight fit on the face, the patient couldn't really go deep, you know. So Dr. Blumenfeld was just talking in his ear, and suddenly he just went, well, and he went into hypnosis. I didn't know that that's what it was. To me, it was just Dr. Blumenfeld's way, you know. And they did the skin graft from the leg to the face, just under hypnosis and a little bit of nitrous oxide being diluted by room air. But she had that magical way with words, but we didn't call it hypnosis. It was just Dr. Blumenfeld's way. And she would have her patients, when we were in the holding area before surgery, she would go and talk to them and start their IVs. And they were always relaxed when they were with Dr. Blumenfeld. But now I know better. And how I got into it myself was in 1987. I was 2 weeks away from spine surgery. I had hurt my back with a couple of car accidents and then lifting up orthopedic instruments while I was wearing a lead gown. And because I worked in the operating room as an operating room nurse first. And anyway, I had hurt my back and I was 2 weeks away from back surgery. And I just was scared when the doctor told me that he was going to go through my abdomen to get to my back. And it scared me. Anyway, so I'm lying on the living room floor, right where I am now. And I put my hand on my hip and started to visualize arterial red blood, because I'm a nurse, right? Yeah. Going into the nerve root and the blue venous blood coming out with all the toxins from the injury. And suddenly my legs started to shake and jerk from the energy of pain that I had been holding for so long. And then that subsided. And then the circulation in my hip, actually, the visualization that I was having actually had my hip start to rise and fall, where you could see it from the blood circulation increasing. And I called over my husband, who was a surgeon. I said, Ken, look at this, look at this. And both of us are looking at my hip just slowly rising and falling. And I did that, and I never had the surgery. And I'm so blessed that I didn't have the surgery, because I treat so many people who have what we call failed back syndrome, where they have one surgery, they fuse it, and then the other parts get work too hard, and then they have to fuse those, and you have 2, 3, 4, 5 back surgeries, and you are worse off in pain wise than in the beginning.
Okay.
Right. So I'm so grateful that I never had that surgery, and I dance and I do everything else. Every once in a while I'll have some, under stress, my muscles tighten and I might have a little pain, but I know what to do with it now. And so I consider myself basically 99% pain-free.
Okay.
you know.
So, what I understand is you were about to undergo a surgery and you
Right?
performed self-hypnosis on yourself with the knowledge you
Yes.
have, and your body started recovering and it recovered and you did not have to go for surgery.
Right. I
That's,
never had surgery.
oh my God, that's the power of hypnosis.
Well, I don't know if it's the hypnosis allowed for the increase in circulation
Mhm.
that allowed for the healing, because our body knows how to heal,
Okay.
right? We may not be chameleons where we could grow another leg,
Yes.
right? But our body knows how to heal. An interesting story, many years later, I'm trying to think about 1995, I don't know, somewhere around that. No, it was later than that, whatever it was.
Okay.
I was jumping over a man in a game called Leapfrog in my daughter's school. And anyway, I tore my ACL
Mhm.
and I tore both meniscus. Now, I had already been learning about anesthesia,
Mhm.
not anesthesia, hypnosis and energy work. And I worked with another hypnotist. Her name is Olga. I can't remember her last name right now, but she passed away. But anyway, I had to wait 6 weeks for another ACL donor because it was football season.
Mhm.
Okay, and there weren't any. And so I had to wait 6 weeks. So during those 6 weeks, Olga and I did energy work together and hypnosis and visualized the healing taking place. When they went, and this was confirmed on MRIs. I mean, you could see the rips on the 2 meniscus. When I went in, he fixed the ACL, and this is Dr. Michael Dillingham, who was the 49ers doctor at the time.
Mhm.
But the meniscus had healed.
Wow.
And he said, he just shrugged and he said, it happens, right? He had no explanation. And it's not supposed to be able to heal because the meniscus has, quote unquote, no blood supply, right?
Oh.
It's just cartilage. So, you know, our body knows how to heal. Doesn't mean that it will always, happen in the
Mhm.
best way, but your body wants to heal.
Amazing.
And so hypnosis allows us to reach for our own inner resources. It's not the hypnosis that's healing, it's hypnosis that's allowing the body to do its natural desire. And
Okay.
sometimes emotions get in the way of the natural desire.
Hmm.
And so sometimes you have to help people find ways to emotionally heal. And that alone will facilitate the body's natural desire to heal.
Awesome. Awesome. Thank you for clarifying that hypnosis is
Mhm.
allowing body to, invest into the natural desire of healing itself. So
Yes,
hypnosis becomes a tool for accessing that body's
tool,
natural.
exactly. It's a tool. It's not the cure, it's just
Yes.
a tool. And so that when people say that it cures, it's dangerous to say that.
Yes, yes, exactly. Thank you very much for crafting your words very carefully.
Yeah, and because you don't want, it's so hard for the medical world to accept it. And so when they hear people say, well, this hypnosis cures this, or I cured someone of cancer, whatever. No, you facilitated the body's own naturalness. You help to facilitate it, right? And so we facilitate our clients going into hypnosis. They're the ones that do it.
Oh.
It's not me, I'm just helping them along.
Awesome.
And yeah.
Wonderful. And thank you for sharing your story as well. And Since you come from a medical background, Seth, so I wanted this interview to discuss around all the health related aspects from the
Uh-huh.
medical perspective. So, is hypnosis helpful for a person who is about to undergo a surgery, to
Oh,
prepare
yeah.
themselves for surgery? Could you please tell about that?
Well, they've actually done a study, I think it was at Mount Sinai, one of the New York hospitals, for breast cancer patients.
Mhm,
And they had surgery and hypnosis, I think it was about 45 minutes before surgery.
mhm.
And they landed up actually taking less medication
Okay.
during the surgery,
Mhm,
less medication post-operatively.
mhm.
And they actually saved the hospital, I think it was about $73 a case, because there was less medicine
Mhm.
and because the patients went home sooner.
Oh, wow.
Yeah, so it actually saved medicine. I could tell you just from the anesthesia part of it, that when you have a patient that who's really uptight and everything like that, and their blood pressure is high and their pulse is racing because they're nervous, and then you put them to sleep, they're going to be usually difficult to manage during the case. They're going to end up taking more medication and
Hmm.
so forth. And then they're going to wake up in exactly the same way that they went to sleep, all anxious and everything like that.
Hmm.
So if you can facilitate having that patient relax before you start to put them to sleep, right? You're really doing justice to them. I mean, it's a good thing. And we have the ability, instead of calling it hypnosis, maybe say the words, we're doing verbal sedation.
Hmm.
Because again, once you say the word hypnosis, it's like, oh, hypnosis, right? And it isn't, it's just verbally helping a patient go into a state of relaxation. Sometimes when I'll start an IV, I'll have a person imagine being in a bathtub and relaxing.
Okay.
Because what really happens when you're in a hot bath? Your veins pop up to the surface, right?
Hmm.
And so very often, if I just have them close their eyes, imagine being in a bathtub and floating in the warm water, their veins will come up to the surface,
Wow.
right? Again, it's the imagination is triggering certain biochemicals that the brain is making to trigger other, biochemical, other neurotransmitters and all those kind of things. And it's just communicating, we are not, our brain is not separate from our body. And so, yeah, so using hypnosis preoperatively, or when someone, let's say they're going to have a hip or knee surgery and they know someone who had the same surgery and they didn't do well, right? Oh, she had the knee surgery, she got infected, she was in physical therapy for years, she's in pain all the time, she had to have it removed and redone. They get nervous, right? And so if you can, like weeks before the surgery, work with them privately to visualize that everything's going to go well, and to future pace and test, have them go to the future and see themselves healing well and then they're going to do better, right?
Yes.
And so I tell people, don't listen to the scare stories, or sometimes they've had their own story that didn't go
Assumptions, stories. Yeah.
right. And then you have to help them to see things from a different perspective. And again, future pace and test with a positive attitude. And so they'll go into surgery better. The surgery will go better. Their muscles will be more relaxed. They'll get more nutrition, more healing. And you can even use it post-operatively for pain management, but also for, let's say, physical therapy,
Wow.
right? So that, because sometimes physical therapy can be painful. And if you can help those muscles relax instead of being like this and, if you start off like this, it's not going to be good. Right? You need to be relaxed and let that nutrition go to your cells and so forth. That's how it's used. And I just wish it was used more often.
Awesome.
Right.
So you have already covered one of my questions, that application of hypnosis in pain management. So you already answered that, like post surgery or any sort of pain issues a person is using. But I have a question, Seth, here.
Yeah.
So pain is useful in a way. Pain has a purpose. So are
Right.
we not discording like body's way of communicating, because body is telling that, hey, there's this pain is the signal of cautioning you that there's something needs to be attention is given. But
Right.
using hypnosis for pain, like wouldn't it contradict it?
No, because you can, when you use hypnosis for pain, you say, the hypnotist would say, and let's say you're in the emergency room and the doctor wants to evaluate what's going on. And you just tell them, when the doctor asks you what's going on, you'll be able to feel the discomfort. I would like to use that word instead of pain, but in the hospitals, they have to use the word pain. They have to, and they have to rate it on a scale of 0 to 10, at least here in the States, it's required. So, and you say, so when you can allow the pain to return, and when you need to shut it off, you just shut it off.
Okay.
So it allows them to do that. Yeah.
Okay. We are not totally turning off from the pain signal. We are allowing it when it is required. It comes.
It's how much do we pay attention to the pain? Okay. And it's still there, but we're not paying attention to it. I remember I had this dental surgery, and they had used local, and they had wanted to give me IV sedation, and I said I don't need it. Right. So they're doing the surgery. It was only supposed to be like an hour, and it was like 2.5 hours. And the local anesthesia was wearing off. And I remember when they were putting in the suture, I could feel the needle go in. I could feel the thread, and I just I had read this book by Hildgard and Hildgard. It was called Hypnosis and Anesthesia, or Hypnosis and Pain. I don't remember about it, but they talked about the hidden observer, and that's just what happened. Is that I got into hypnosis, and I'm on a beach in Hawaii, and I'm using the dentist's light as the sun in my imagination, and I'm on the beach, and I could feel the suture going in, and I remember thinking, oh, this is what the hidden observer is. I had no quote unquote pain, but I could feel it, but it didn't hurt. Okay.
Got it.
And it was very interesting. It was very interesting.
Awesome. So you lived your.
I lived it. Yeah. It's very good to experience these things by yourself.
Yes.
Absolutely.
And said, like, people who are going through some cancer treatments, especially like chemotherapy and other stuff, like it would be painful. So in such situations, would application of hypnosis helps?
Oh, it's wonderful for it's an emotionally hard thing to go through. A physically hard thing, can be painful. It's hard for the family, the caretakers. It's a hard thing, and hypnotherapy can help so much for cancer patients. I had a client of mine who came to me for stop smoking, and of course it was successful. And later on, many years later, she got breast cancer, and she contacted me again, and she had a needle phobia of all things too, and a doctor phobia, and pretty severe. And so we hypnosis we used for the needle phobia to go back to the first time it ever happened for her. And because usually there's a time when it happens and it builds and builds and builds. And we released that with different hypnotic techniques. And I am a believer in regression because it has its place. It turned out she was an incubator baby for 3 months, and they were always doing heel sticks and different needle sticks. And that's where her phobia started.
Oh,
right. And so anyway, but also for the chemotherapy, as far as for nausea, usually there's surgery involved or radiation. And so surgery, the typical, anxiety of surgery, there's pain management, there is using it for people's physical vision of themselves. People lose their breast, they lose their leg, they have a pouch for their excretions instead. If they've had their part of their intestines removed, now they have a bag, that they have their bowel movements in on their stomach. There's a lot of physical things. They lose their hair. All these things that hypnotherapy can help them with, that body image, and not loving themselves instead of looking at themselves and hating how they look, which is what it usually is. To change the perspective and see themselves as a survivor, not a victim, but a survivor, a warrior. Another way to use hypnosis for people with cancer is facing death, because sometimes it'll happen. It happens to all of us. That's but and see, okay, so how is this like a gift? Well, the gift is you get to change your life a little bit and notice things that you weren't reacting well to. Maybe you didn't have boundaries. Now you've learned boundaries. You've learned to speak up for yourself. You've learned how to say no. You've healed relationships with people that maybe you wouldn't have, because now you're being forced into it. You get to share maybe your history with your grandchildren, right? Which is because we could be in a car accident and boom, we're dead. Okay, so in a way, not that this is how we want it, but in a way, if we see it as an opportunity to decide how the rest of our life is going to be, instead of just dropping dead from a heart attack, right?
Yes.
I mean, there are aspects of it. And so if you could appreciate the aspects, there's a saying about making beauty out of the ashes, right? And so, sometimes that's it. But again, you have the financial distress, and also with the family, because it is hard on the caregivers, right? It's really, really hard on the caregivers. So you have a whole mix. Oh, energy is another one, right? Because they use energy. And another area to work with, what works really good, is appetite.
Okay.
We can get people hungry and imagine what that food tastes like, because sometimes after chemotherapy, the food tastes terrible.
Okay.
Right.
Okay.
And so if you have them remembering the food and things like that, it's really that part is really satisfying. Well, it's all satisfying, but it's really nice to see people start to eat.
Wow.
Even though they can't taste it, or it tastes like metal, is very common, right? Excellent. So very gratifying place, and you get to really know people, because it's usually a journey of 1 to 2, 3 years.
Okay. Yeah. Wonderful. Such a beautiful modality this is, said. Unfortunately, a lot of myths. So these type of interviews will help people to bust the myths around the hypnotherapy and see the such a beautiful thing. And when it comes to lifestyle change for the most biggest issues, of course, killers we can call, but still diabetes and cardiac diseases. Said what is the role of hypnosis for these things?
Okay, so you would think that being a nurse, I understood diabetes and heart disease.
Okay.
Well, I got a really interesting look at it with my husband.
Okay.
And cardiac disease and diabetes. And I saw that it's not an easy thing to live with. And a lot has to do with lifestyle. Yes, there's genetics involved, absolutely. And a little bit after he died, I got a chance to do, work in the operating room at a dialysis surgical center just for dialysis patients. And basically, they're all diabetics or cardiac disease.
Oh.
That's it. Every once in a while, you'll have someone with a different reason that their kidneys shut down, but usually it's from diabetes or heart disease. And it's a horrible way to live the rest of your life. 5 hours, 4 to 5 hours, 3 times a week for the rest of your life. And you lose your limbs, you lose your eyesight, you have to have surgeries to make new connections because they don't last. It's called the AV shunt, and they connect the artery and the vein so that there's more, they can get the blood out for the dialysis machine. And they get stenosed, they need to be surgically redone. And I mean, it's just a horrible way. And meanwhile, you're fading away. And it is the most, and people live the rest of their lives, like 10 years if they're lucky. And it's like an out of control of your life. And it really got to me because if people understood, because I as a nurse didn't understand. I mean, I read about it, I knew about it, but to see people living it is very different. And so if people understood that, no, it's not okay to have diabetes because, oh, well, I'll just take my insulin. No, you don't want to get to that point. Okay. Because the body gets worse and worse and worse. So if you, and the same thing with heart disease. So if you change your lifestyle before you get to that point, right? Because their doctor tells them, oh, you got to lose weight. You got to relax. You got to lose weight. And nobody does it. I'm working in a surgery center now, and I've never seen how there's so many people who are overweight. Now, the pandemic put a good 20 pounds on a lot of people too, right? Yes. But it's like, at least here in the United States, people are getting heavier and heavier, and they are talking about the diabetes becoming, even starting to reach our children. And so we really need to help people change their lifestyle. Okay. Right. And even though they know to do it, they don't do it. Okay. Okay. Yeah. So that's where hypnotherapy can help people to get the motivation, the reason, and to keep them doing it until it actually becomes part of their habit. Like I'm on the exercise cycle 5 o'clock in the morning, at least doing 20 minutes, and I would tell people my age, but I won't. But people, when they find out how old I am, they're just amazed. And I haven't had surgery on my face or anything like that. But it comes from lifestyle. It comes from choosing what to eat. It comes from being aware that holding on to toxic emotions is toxic to your health, to your mental health. And you need to continuously work on yourself. Yes.
It's not one day job, it's a lifetime.
Exactly. Yeah. And sometimes it's harder than others. But if you give up, then you give up, right? and you just can't give up, right? So, yeah, that's my wisdom of getting old.
And this is my last question, Seth, because I have seen a lot of people having ideas from decades, and it is more to do with emotional stuff, is what I have observed. It could be other reasons also. But role of hypnosis in helping people with IBS, could you please share some insights?
That is one of the most studied areas of
Okay.
hypnosis.
Mhm.
And why? I mean, thousands have studies of patients. In England, I think it was Whitehouse, I think that was his name, Paulson in Chapel Hill. They've done like thousands. And so they know that it changes the symptoms. I don't know why gastroenterologists don't routinely refer to hypnotherapists or even psychologists who
Psychologists.
It works so well. And again, working in a surgery center, I can tell you, when I have a patient, I'm looking in their record, right, and they have IBS, they're on anti-anxiety medication. I mean, there are more glial cells, which are the cells in your brain, the glial cells in your intestines than in your brain.
Okay.
That brain-gut connection is very, very real. And so if you want to say to somebody, okay, well, how about you're going to stand up in front of class and you're going to lecture, right? Or give a speech or whatever, and you feel like you're going to throw up. Where is that coming from? That's that brain-gut connection, right? And so if we can teach the intestines to calm down, teach our clients with repetition. Repetition is the very important part, because you are retraining the muscle, the brain, its reaction to events, and you are retraining the musculature in the intestines, and it calms down.
Wow.
Right? And now some people are more prone to it. This is for real. It's like, I have an iron stomach. I never have anything. My husband was very sensitive and could feel all the things in his stomach, churning and all that kind of stuff. So that's part of it. But it's definitely people who are more anxious, I have noticed, have that IBS. Now, what I have noticed with throughout my years, there's constipation IBS, there is diarrhea IBS.
Okay.
And there's also a combination. But in general, what I have noticed is that people who hold on to their feelings, don't express hold in their feelings, are the ones that have constipation IBS.
Okay. Okay.
The ones who have denial that they have any feelings at all, oh, nothing's wrong at all, they tend to have diarrhea IBS.
Okay.
This is just, I don't say, it's not written in stone, it's just what I observed. I had one gal, her mom had been in a car accident, and for some reason, the gal blamed her father that the mother was in the car accident, that the mother was driving that day. And the mother became, I think, a paraplegic. And actually, the mom came to me for, I think it was pain management in the areas that, anyway, but she gave me her daughter for IBS, her referred daughter. At one point in our work together, her daughter actually in the kitchen was screaming at her father, which is something she never allowed herself to do. And her IBS got better for a little while. The constipation IBS got better. She let go of the feelings instead of holding them. So, that kind of stuff. But yeah, it works. And that's because the brain gut connection is very, very real. And it's been studied so well. I don't understand. I mean, I know the gastroenterologists, they have to look, they have to see, is there anything else that's causing it? But once you know that there's nothing else causing it, why don't you routinely send your clients for psychological, what they call gut-directed therapy?
Yeah.
Because it's well studied. I don't get it. Anyway.
So thank you very much, Sid, because this was the medical side of application of hypnosis and how you yourself have experienced in facilitating body's own natural healing system with the help of
That's exactly.
hypnosis, and how it is useful in different treatment. It is like supporting tool.
Yeah, it's
Hypnosis for the,
supporting.
yeah,
Yeah,
and,
yeah.
it was nice to capture all this from experts like you and make it available to public so that they will have all these preconceived misconceptions
I
about
know.
hypnosis. And yes,
Hypnosis.
oh my God,
That's,
hypnosis too.
that's why I like to use the word hypnotherapy. It's a
Yes,
little more gentle,
gentle.
or right? Yeah.
Yes, and that's how I'm reaching out to various experts, and I'm really grateful to you for your time and sharing your experiences. Thank you
Oh,
very
thank you so much. Thank you so much.
much. Okay, Jay. Thank you.
Namaste.